Hi, you guys. Welcome back for our daily practice questions. As always, I like to first introduce myself and go over my disclaimer and reminder before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one-on-one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I like to always go over a disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office with complaints of tracheal pain. The nurse practitioner is planning to treat with antibiotic management. Based on the patient's presentation, how should the nurse practitioner treat? Is it A, Bactrim drops, B, doxycycline drops, C, ciprofloxacin drops, or D, no treatment is required? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, based on the patient's presentation, how should the nurse practitioner treat? Now, y'all know, I tell y'all, if they're asking for the treatment in the stem of the question, run it back and see if they've provided you with the diagnosis. If they have not provided you with the diagnosis, you need to take it back a step further and look at the assessment findings so that you can determine a diagnosis, because we need to know what it is to treat it, right? So here, a diagnosis has not been provided. So let's look at these assessment findings. It says that the patient presents to the office with complaints of tracheal pain. Now, start to think of the things that commonly and classically present in a certain fashion. You need to know things when you're looking at the full picture. Always look at the assessment findings as how they present, those signs and symptoms. Then we work our way down as far as diagnosis, evaluation, and treatment. Tracheal pain is a classic identifier for otitis externa, right? Outside of that ear pain, that's the most common symptom. When you see this, so you should start to think otitis externa, and what is that first line treatment option that we would utilize for antibiotic management? And it would be C, ciprofloxacin drops. Okay, so ciprofloxacin otic drops will be our first antibiotic option to utilize. Okay, so C is your best answer. Question number two, a patient presents to the office with complaints of otalgia. Upon examination, the tympanic membrane is red and inflamed. The patient denies any known allergies. What is the first line treatment option? Is it A, augmentin, B, Bactrim, C, clindamycin, or D, amoxicillin? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, what is the first line treatment option? So again, if they're asking for a treatment, run it back and see if they have provided you with the diagnosis. And if they have not, you need to look at the assessment findings. The diagnosis is not provided here. So let's look at our assessment findings. And when we're looking at this, I want you to pay attention to their age, their ethnicity, everything they're providing to you about this presentation and that chief complaint, etc., because this gives you a full picture so you can start to tie things together and determine and think of differential diagnoses, okay? But here, a patient presents to the office with complaints of otalgia. Okay, otalgia is a common complaint with acute otitis media. It also notes that on exam, the tympanic membrane is red and inflamed. This is also a classic presentation on examination for acute otitis media. So we're going with that as the diagnosis here, okay? So the first line treatment option for this would be D, amoxicillin. Remember, Brittany's Brilliance, I tell you guys to think of the A's. A for acute otitis media, A for first line therapy of amoxicillin, A for second line therapy of augmentin, and then in the event that you can't, if you have utilized those two, or if you have a penicillin allergy, A for azithromycin, okay? All right, and lastly, question number three. A patient presents to the office with complaints of nasal drainage with associated pain above her right eye. She states it feels as though there is pressure above her eyes. She has a documented allergy to penicillin. What is the best treatment at this time? Is it A, amoxicillin, B, doxycycline, C, azithromycin, or D, Keflex? Take a moment and tell me what you got. All right, you guys. So, stem of the question states, what is the best treatment at this time? So, again, treatment we're looking for. Let's see if they give us the diagnosis. If not, let's look at their assessment findings and how they present. So, there's no diagnosis included. So, it says a patient comes to the office with complaints of nasal drainage with associated pain above her right eye. Sounds like sinusitis. Also says that it feels like there's pressure above it. So, it's really sounding like sinusitis here. Remembering, when you think of sinusitis, we think of all of our treatment options, and our first line therapy is your augmentin. But always, when they have an allergy listed, make sure you make a note of it, highlight it, whatever you need to do so that you don't forget this when you are trying to work through your treatment options. Because here there is a documented allergy to penicillin. Remembering that augmentin has a penicillin component, right? Because it is amoxicillin and clavulanic acid. That makes up augmentin, right? So we can't go with that first line. We can't go with amoxicillin because there is a penicillin allergy. But the guidelines for sinusitis is first line augmentin, and if penicillin allergic, then we go with doxycycline. Okay, so the best answer is B, doxycycline. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. As I told y'all, as we continue our antibiotic series, I will now guide us through the system in a fashion like this, where you're not just having specifics of this is the diagnosis, how do you treat, but now you being able to break down what it is and determine the type of diagnosis, and then go down the treatment path as well with these antibiotics. Okay. So now we're going through a little bit more from the knowledge perspective, but applying it in several fashions so that if you have any of these on boards, you know how to pivot based off of how the question is provided to you. And if you need any of the resources that I do offer, feel free to reach out to us at the Nursing Studio. Y'all can give me a call, 803-400-6864, or shoot a text message to this number. Or you can shoot an email to thenursingstudio, the number 1 at gmail.com. The things that I do offer on my review book, it is an ebook option as well as paperback option, both linked in the bio of this channel. If you are getting the ebook option, of course, once purchased, you have access immediately. And then the paperback option is shipped out to you guys. It is broken down by system, designed for family and adult gero. And there is a non-clinical section as well. If you prefer to study independently, or also people prefer the self-paced review, if you like to listen to audio on the go, my online self-paced review is designed for family and adult gero for both exams, the ANCC as well as AAMP. You can watch the videos. It's broken down by system. You can watch it as many times as you like. Listen to it. Some people just listen to it on their phone, or sometimes they play it in their cars as they're commuting to work and different things, and it just gives you uh, an additional way to listen to things briefly and quickly, to get it ingrained, and retain it. Because my saying, repetition is the key to retention. So if that's your style of studying, that is also linked to the bio of the channel. It is a self-paced review. If you're looking to do any practice questions, all of my QBank options are also linked in the bio of this channel. And y'all know my one-on-one sessions, I always say to reach out either by phone, text, email, because each one is customized. So I like to gauge what you truly need. So reach out so that we can determine which one-on-one option is best for you. My one-on-one options that I do provide, you can book a session for weaknesses. You can book a session for exam readiness assessment. You can book a question analysis session, or the custom package is designed specifically for if you are looking to study over a long period of time with assistance. I provide you with a pretest, and based off of that and the duration of time that you're looking to allot to studying, I work alongside with you, structure a study plan for that time frame, and take you to a successful exam attempt. So if you're looking for any of those options, feel free to reach out to the Nursing Studio. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.